Let's begin with section 3 of our lecture. And in this section 3, we will talk about the signs and symptoms and then diagnosis and treatment of nasopharyngeal carcinoma. We already talked about the pathology of the nasopharyngeal carcinoma. What are the effects of the spread of the nasopharyngeal carcinoma? What are the 3 types of the nasopharyngeal carcinoma? After knowing all that information, now let's move and see how it presents, what are the signs and symptoms of nasopharyngeal cancer, and then how we can diagnose it and how it can be treated. Clinical features, again, as we already discussed about the spread of the nasopharyngeal carcinoma. So the features mainly will depend upon the extension and the area which is involved by the nasopharyngeal carcinoma. So if there is nasal symptoms or features which are produced or caused by the nasopharyngeal carcinoma, we have nasal obstruction, nasal discharge, denasal speech, rhinolalia clausa. It's known as the denasal speech, is also known as rhinolalia clausa. And then we have epistaxis, which is bleeding from the nasal cavity. All these are the clinical features produced by the involvement of the nasal cavity by the nasopharyngeal carcinoma. Epistaxis, bleeding is common. Then there is denasal speech, known as rhinolalia clausa. Then we have nasal discharge and nasal obstruction. Other is the involvement of the ear or the signs and symptoms, otologic signs and symptoms related to the ear. Otologic is the related to the ear. Auto is for the ear. There is conductive hearing loss. The sound waves are not transferred properly, or there is obstruction to the transfer of the sound waves. That's why it causes conductive hearing loss. Then we have serous or suppurative otitis media. If you remember, when we talk about the spread of the carcinoma, if that spread to the eustachian tube, which is the tube that extend from the oral cavity to the middle ear, to maintain the balance and the air pressure, if that is involved, then it can cause serous otitis media. So again, suppurative or serous type of otitis media can occur. There is tinnitus, which is the ringing in the ear, and also dizziness. So all these are the effects caused by the spread of the carcinoma to the ear or involvement of the ear. Then ophthalmoneurologic features are squint and diplopia, double vision, squint and diplopia, ophthalmoplegia, paralysis of the muscles of the eye, so ophthalmoplegia, facial pain, reduced corneal reflux. All these are the features produced by the involvement of the ophthalmoneurologic. Then cervical node metastasis spread to the lymph nodes present in the neck definitely will cause the swelling of the lymph nodes, enlargement of the lymph nodes, and lymphadenopathy. Then the distant metastasis, if it spread to the distant area, then we have cervical lymphadenopathy, hearing loss, nasal obstruction, epistaxis, cranial nerve palsies, headache, earache, neck pain, and weight loss. All these are the clinical features or presentations depending on the distant metastasis of the nasopharyngeal carcinoma. Diagnosis is by endoscopic evaluation. Endoscopy is performed and to examine the growth or mass directly, and at the same time biopsy can be performed to look out or find out if it's a benign, malignant, or if it's type 1, 2, 3 according to the WHO terminology. So endoscopic evaluation of the tumor. Imaging studies, which is CT, MRI, all those are the imaging studies. CT scan, MRI, X-ray, CT of the chest for any spread of the tumor to the lungs. CT of the abdomen or ultrasound for secondaries in the liver. So all these tests are performed. This will tell whether the carcinoma is metastasized to the lung or the liver. So different areas are examined. PET or positron emission tomography scan. Biopsy is very, very important for the diagnosis of carcinoma, should be performed to find out the staging and whether it's carcinoma or some other growth. Audiogram for hearing test. Then the classification of the nasopharyngeal carcinoma, which is the TNM classification, in which we basically study the tumor size, whether it is localized to the area or it is already spreading, extending, what's the size of the tumor. And then we also study the node, whether the tumor spread to the nodes, if one node is involved, more than one node is involved, if it's on the same side or if it's on the contralateral side. All these are studied in the TNM classification, and then also metastasis, whether it spread to the distant area or it didn't spread to the distant area yet. So depending on that, again we have T1, which is tumor confined to the nasopharynx, T2 once it start extending, T2A, 2B, T3, T4, again different size. If the tumor is spreading, it gets spreading to the distant areas or side, there is increased in the number. So it's from T1 to T4. And then the nodal involvement and X, which is not a regional lymph node, cannot be assessed, and X not assessed at all, and no lymph node involvement, and one unilateral in lymph node, and 2 bilateral metastasis, and 3 metastasis in lymph nodes. Then we have 2A, 2B. Then distant metastasis is how far it is metastasized. Then staging of this nasopharyngeal carcinoma, depending on TNM classification, we have the stage 0, which is carcinoma in situ, small, no nodal, no metastasis. Then we have stage 1, 1A, and then we have stage 0, stage 1, then 2A, 2B, 3, 4A, 4B, and 4C. So the staging of nasopharyngeal carcinoma is from stage 0, 1, 2, 2A, 2B, 3, 4A, 4B, 4C. Depending on the TNM classification, what's the size of the tumor, how far it is extended, and what are the sites involved, and if there is any node involvement or if it is metastasized to the distant sites or not, that gives in the staging, which is in the 0, 1, 2A, 2B, 3, 4A, 4B, 4C, and it keeps on becoming more and more serious more metastasized to distant sites, more hard to treat, and usually at this end stage with the supportive management or palliative type of management is given to the patient to improve the life standard or of the patient. So that's how the staging is done. Treatment is radiotherapy, external beam radiation, again high dose 6,000 to 7,000. Then chemotherapy, the drug used for chemotherapy are cisplatin or cisplatin with 5-fluorouracil. These are the treatment options. Other malignant tumors of the nasopharynx, we have lymphomas, rhabdomyosarcoma, plasmacytoma, adenoid cystic carcinoma, melanoma, which is rare. So these are some other malignant tumors of the nasopharynx besides the nasopharyngeal carcinoma. So this was all about the nasopharyngeal carcinoma. Thank you for watching sqadia.com.